So, can you tell us a little bit about the Take Back the Streets campaign and the Summers at Skiddy Park?
Absolutely. So when the Learner Center came to talk with peacemaking back in 2015 with the Near Westside Initiative, the Gifford Foundation, a few other community partners, it had been acknowledged that there was a little bit of a lack of communication between service providers with each other about the types of services that were being offered, and a little bit of a divide between service providers and the community that we serve and the residents. And so as a solution to that, or an attempt to address it, we decided to get together a lot of the service providers and start meeting on a regular basis, so that each organization had a point person, a face that was friendly and familiar at each other organization. And having that regular communication really opened up a lot of possibilities for collaboration. And so from those early conversations, we formed the Take Back the Streets campaign. The service provider collaborative side kind of came together and coalesced first. And our first year goal in 2016 was to do 50 positive, family-friendly, free events in the community in 50 weeks. And through much collaboration and hard work, we achieved that goal and actually surpassed it. And the idea behind doing that many events in 1 year was to really send a message of a united front, that the service providers are communicating, are collaborating, are working together, and that one of the needs of the community that we were responding to is this need to occupy public spaces where, and maybe even spaces where there was a perception that there was a safety problem there, and fill those spaces with positivity and with fun and with activities that really show the community, like, this space is for you and you need not be afraid to be here. And then moving into 2017, the resident engagement, the resident leadership part of the campaign is really coming together. So we also recognize that there is a need for residents to take more of a leadership role in designing programming, in making decisions, in having a voice at community meetings where resources are allocated and decisions are made. And so partly through the kitchen table talks, partly through outreach strategies, resident leaders emerged and then began recruiting their fellow friends and neighbors to form a group. We put the core group of about a dozen or so residents through a community health worker training so that they could view the community organizing work that they were doing and issues surrounding public safety through the lens of public health, so that they started to really identify that intersection between safety and health and realize that, okay, if we address these primary needs first, of feeling safe in our community, of being safe, but of also feeling safe and having a perception of safety. If we can address those needs, we can really dig in and focus on health, on eating better, on exercising together, on getting outside more, on educating our youth about making healthy lifestyle choices early on in life so that they have a lasting impact. And the residents have been the best advocates for that.